cold, very cold February morning. We're fortunate this morning to have two individuals from Bozeman joining us. Sarah Jestrab and Sindra Stahl are going to present about the Office of Rural Health and the Ahec office in Bozeman. I'm understanding, Sarah, that you're going to go first, so you're up to bat. Good morning.
Good morning. Thank you so much. So I'm going to go ahead and share my screen here. All right, hopefully you can see that really big there. All right, so like Dave said, I am Sarah, and I am a project coordinator with the Montana Office of Rural Health and Area Health Education Center. So this morning we're just going to go over what our office is doing and working on, and how we are really supporting rural health across the state of Montana. So just to dive in here, the Montana Office of Rural Health and Area Health Education Center are co-located on the Montana State University campus over in Bozeman here. So our Office of Rural Health is grant funded through the Health Resources and Services Administration, or HRSA, and more specifically, the Federal Office of Rural Health Policy. So our mission is to help individual rural communities build healthcare delivery systems through the collection and dissemination of information, technical assistance programs, and also helping to coordinate rural health interests on a statewide level. Meanwhile, the Area Health Education Center is also funded through HRSA, but it's funded through the Bureau of Healthcare Workforce. And the mission of Montana Ahec is to enhance the access to quality healthcare, particularly primary and preventive care, by improving the supply and distribution of healthcare professionals through community and academic educational partnerships. So to get just a little bit into the history of the Ahec program, it was developed by Congress back in 1971 to recruit, train, and even retain health professions workforce committed to underserved populations such as rural. So grants to fund AHECs were made to medical schools within each state. The only exception to this has been the University of Washington School of Medicine. So in this case, the federal government provided funding to the University of Washington School of Medicine to start AHECs in Wyoming, Alaska, Montana, and Idaho, which are all regional partners, or all partners in the regional WWAMI program. So in 1985, the Montana Ahec was actually implemented, and this regional WWAMI Ahec office was located at Montana State University in Bozeman. But then in 2007, some new rules were implemented that allowed colleges of nursing to apply for these Ahec grants. So at that point, the Msu College of Nursing applied and was awarded the grant from HRSA to establish at that time 4 regional Ahec offices in Montana, in addition to our program office here. So the next slide here, in 2007, our first 2 centers were established in the state. So those were the South Central Regional Ahec, which was originally set up in Dillon, Montana, but has since moved to Helena with the Montana Hospital Association, and also the Eastern Regional Ahec over in Billings at Riverstone Health, and it's still over there today. We have since added the Western Montana Ahec located in Missoula at the University of Montana campus, and also our North Central Regional Ahec was added in about 2010, I believe, and it is now co-located in Helena as well with the Montana Hospital Association. So the final center, the 5th and final center that's been added, is the Northeastern Regional Ahec, and that is over in Miles City with the Montana Health Network there. So each region has their own director / program manager and established regional advisory council, and works to develop healthcare workforce strategies for their regions. So just kind of a snapshot there on our coverage here. So from here, we thought we'd dive just a little bit deeper into some of our project areas. So specifically, we'll share about the projects we have focused on the hospital, clinic, and community development side of things. Share a little bit about our Montana Ahec Scholars Program and workforce development opportunities. And finally, end with sharing a little bit about this COVID health equity grant that our office has recently received, because you might start seeing our name on that one a little bit more here. So to kick things off with our hospital and clinic community-based programs, so this is under the lead of Natalie Claiborne in our office on the Office of Rural Health side of things. So our Community Health Services Development Project is actually the project that I lead and know most about here. So a little bit of bias there. But our Community Health Services Development Project is essentially just our branded name for the Community Health Needs Assessment process. It has been designed with the healthcare facility as its focus. Our survey tool, or our questions through the survey tool, key informant interviews, and even focus groups are really designed to assist the health system to plan those services and collaborations for the future. So this process aims to assist the facility in creating their meaningful community benefit plan if they are one of those 501c3 hospitals. And finally, since it is such a long-standing program, we've partnered with many of Montana's critical access hospitals multiple times since the inception, which allows for the ability to track community health needs both longitudinally for that specific health system, but also in an aggregate form on a statewide level. So we do host a data hub on our website that shares out the most current hospital and even public health department assessments. We also share out community-based secondary data analyses and resources as well. So I will be popping a link to our data hub in the chat here in a little bit, so stay tuned for that. There is also an aggregate statewide snapshot that was published back in July of 2021 and can also be found on our website too. So you can see kind of the landscape of Montana and what we're seeing through these assessments. So the next little area on here is our Rural Health Initiative, or RHI. So this is a collaborative network that's linking prevention and community-based wellness programs throughout Montana. And RHI really engages partners to share ideas and expertise to support communities in improving health. Bumping down to our POND program here. So that's the Practice Operations National Database. And this is a web-based software and rural health clinic benchmarking system that allows for data collection and analytics for RHC data. So the data collected assists rural primary care providers to optimize clinic financial performance, compensation, productivity, and even benchmarking within their state peers. The next little group here is our Lean project, and this is a partnership with the MSU Industrial Engineering Program, and it places students in critical access hospitals to conduct a process improvement project. So really assisting the hospital to identify areas of waste in their processes and or procedures and eliminating that. So finally, we have a weekly newsletter that shares out relevant training and funding opportunities, as well as a quarterly policy newsletter. So I will also drop the link to our main website where you can subscribe to that newsletter here too. So with that, I'm going to turn it over to Cindra for a couple slides here.
Thank you, Sarah. Sarah did such a nice overview of our Ahec regions and how Ahec got started. The picture is Mandy Hedstrom, and she is the statewide director of this particular program, which is the Ahec Scholars. The Ahec Scholars program is a branded certificate program that prepares and promotes a very skilled primary care workforce. It's very specific as far as the requirements go, 40 hours of community-based experiential training, and then 40 hours of interprofessional coursework, which includes the 6 topic areas that you can see here. In our next grant round, which is coming up soon, there are an additional 2 core topic areas that we will be moving into, but the outcomes of the intended outcomes of the project are to help students to learn how to work effectively in team-based settings. I think that's probably the main goal. They develop new skills, experiences, and strategies on how to improve access and delivery of healthcare. They have a chance to meet healthcare leaders in the field, make connections, especially with other participants across the state. Again, this is a nationally branded program, and one of our focus areas that we're working on now is spreading the word on hiring. If you hire someone who has gone through the Ahec Scholars Program, you can expect that they are well-trained and have devoted some time to really learning how to function in a group. I might say that Montana has, I think, has done a tremendous job with their Ahec Scholars Program. At this point, there are 278 health profession students enrolled, and they are across 15 different academic programs across the Montana University system, as well as Carroll College and Gallatin College. So we're happy to have associate degree folks enrolled with us also. I think that's it on that slide, Sarah. And here I am, a lot more workforce programs that we're involved in. The Montana State University participates along with the University of Montana in a Montana University System interprofessional education group. So we are working together. Again, many of the programs that the scholars are involved in are across both universities. And we are working to broaden our reach and work together across the universities to continue to develop health professionals who can work together as a team. And so the IPE Institute is an ongoing effort that's across universities. The Montana Graduate Medical Education Council is very active and supports the work of the stakeholders in developing medical residencies. Many of you may know that we have 4 medical residencies in the state at this point in time, and residencies are the step that physicians must participate in before they can actually practice. Our goal is to develop the physician workforce in Montana, and especially in rural and underserved areas. Those really small rural and frontier areas are very, very challenged with all kinds of workforce issues, and physicians are in need. If we can support and get some training in rural areas, that will help in the recruitment and retention to those areas. So we enjoy the support of very many stakeholders and hope to develop more physicians in rural. The Healthcare Workforce Advisory Council was developed in 2011, I believe, as an ad hoc group, I guess, or volunteer group to help look at workforce issues across the state and have some input in developing a workforce that's appropriate for all of us, especially rural frontier areas. It's staffed by the Montana Ahec, mostly me, but all that means is that I set up the meetings and facilitate great discussion. So this group meets about every other month, and we've been meeting on Zoom, and that seems to work really well for us. Lastly, Montana WWAMI, which many of you know, and Sarah mentioned WWAMI, the Washington, Wyoming, Alaska, Montana, and Idaho Medical School. We support Montana WWAMI. A couple of our Ahec areas do specifically organize clinical rotations and clinical rotation sites. I believe Billings and Missoula are the Ahec regions that do that. So they support the students who are doing the rotations with housing and where to be when, and really facilitate getting those rural and more urban rotations for the WWAMI students, and those are typically third years, I believe. So that is Montana WWAMI.
Alrighty, so the next little grouping here that we're going to go over is our workforce development. So more on that behavioral health side of things and paraprofessional workforce. So under the workforce development, our office has 4 HRSA grants that are specifically aimed at supporting behavioral health and paraprofessional workforce. So very exciting little section of our office. The first is our Community Health Worker or CHW program. And this is a 7-week course that takes about 85 hours to complete. It's completely instructor-led and hosted through our office, so the Montana Office of Rural Health and Area Health Education Center. The next grant we have is for our family support program. So it's called the Montana Family Support Program. Might have a little bit longer of a name. I always forget this one. But it is a HRSA funded grant program with the goal to increase the number of behavioral health related paraprofessionals throughout Montana who are prepared to work with youth and families that are feeling the impact of opioid use disorders and substance use disorders. So there are links on our website to some of that support too. If you are interested in learning more, I can drop that in the chat here too. The third grant we have in under the behavioral health umbrella is for a behavioral health training program. This is also HRSA funded and designed to prepare community health workers, community paramedics, and peer support specialists to work in team-based models of care in order to address the social and behavioral health needs of our frontier and rural communities. The final program that we'll describe under this behavioral health umbrella is our partnership between Montana State University's College of Nursing, and that's the Doctor of Nursing Practice, and also Psych Mental Health Program, Msu Billings College of Health Professions and Science, and finally the Montana Psychiatric Residency Program at Billings Clinic. So the goal of this program is to provide interprofessional development or interprofessional training in professional behavioral health trainees to increase access to quality and culturally appropriate behavioral health services in Montana's counties and in Eastern and North Central Montana. So really neat opportunities there. I will drop the link to our directory in the chat here because Beth Ann is a really good contact on it if you have any questions about these ones. With that, I'm going to turn it back over to Cindra to go through our some of our nursing and dental work.
We cover the spectrum here at the Ahec and the Montana Office of Rural Health, and we have something for everyone. There's paraprofessional programs, there's associate programs, there are physician connections, and here we've also got a dental connection. The Ahec offices support student rotations for the University of Washington dental program, and that program is called the Regional Initiatives in Dental Education. And so our Ahec offices do help to get dental students into rural and often tribal communities too, to experience what that practice might be like from a dental perspective. We hope at some point that we can continue to expand that program. And that program, DPHHS is also involved in that and helps us with the dental ride program. The MSU College of Nursing has a couple of really great grants that look really specifically at training in rural communities and frontier communities. The undergraduate HRSA NEPCure program, what we're really focused on there is the rural primary care track and clinical. We support and organize the rural clinical track and then offer the reimbursements for that. It has a primary care emphasis and again, supporting rural practice. The graduate, a new program, again, Rural Ready Nurse Practitioner Scholars. Those are more advanced nursing students and really trying to get the experiences in rural communities and supporting those. That's so crucial to recruitment into rural and retention into rural areas. So we're happy to support a real rural workforce and train them for the situations that they may see as rural practitioners. There's 2 nursing grants, okay. And the last slide, Sarah, thank you, is a COVID-19 health equity grant. We waited a long time to get this one through, but we've got it now. And we're so happy to be able to support workforce training that you all may find interesting, in that it really supports community health workers and community integrated health. We are looking to hire, or we are helping to support hiring 30 community health workers and at least 20 community integrated health professionals that will be hired and deployed statewide. Specific trainings have been developed with a little bit of a COVID-19 emphasis, and contract tracing, reporting, working with tribal communities, minority communities, rural underserved populations, and developing some proficiencies in community outreach and education, patient advocacy, social determinants of health, barriers to healthcare, a very, very broad range, but again, looking at a real rural community emphasis there. So again, community health workers, community integrated health, big numbers for us here, looking for training, and we hope that you will keep this in mind. And if you think your facility might want to participate in that, or you know of somebody, we're happy to get you connected to the right folks. Lastly, we have developed and have just started meeting with a Montana Health Equity Task Force, again, out of this grant. We had talked about the Ahec regions, and we're looking at our health equity task force being broken down by the same regions. Montana's a great big state, and we don't have the same issues from east to west or north to south or tribal to urban. And so we're hoping that by having a task force that looks very regionally, we can develop some good techniques, a toolbox, what's going on, what's the primary focus in those regions. And out of our task force, we do hope to develop a really nice toolkit and celebrate what we're doing well, and really focus on those things that may need some tweaking. Initially, out of COVID, that's really opened our eyes to health equities that have come about or been exacerbated by COVID. But we know that health equity needs to be developed across the spectrum. And so we're really excited to work on our health equity task force. I believe Alana is one of the participants in a group that I'm facilitating out of the North Central region. I would just offer that if you are interested in participating in our task force, anybody, we welcome all comers and all participants, and you can contact Sarah or myself, and we'll get you there to the right connections. All of our programs are willing to take anybody in, and if you've got any questions and she or I don't know the answers, we can get you to the people who might. You might just go to that last slide, Sarah, which is our contact information and our website. And again, we have lots of areas that folks can participate in, and very specific areas for what your interests may be, and a lot of workforce projects that are going on, and other things. So anyway, I think at this point we can look at questions.
Thank you both for the excellent overview. Sue Bailey has a question. Sue, why don't you just chime in? We have a small enough crowd here that I'd like to have a little bit more access on the part. Why don't you talk about your questions so there's some background to it? Sue? The question is the community health worker grant related to the Resilient Yellowstone grant that Healthy by Design is overseeing?
Yeah, can you hear me now?
Yes.
Okay,
Why
yeah,
don't you give us some background?
our organization is one of several grantees that the Healthy by Design has also gotten a COVID-related grant regarding resilience issues in the community that were illustrated during the COVID period. And basically, it's also working with establishing community health workers as well. So I was wondering if there are two grants doing this, or if you are somehow related to the funding that Healthy by Design has then passed on to a number of Billings community agencies.
I might say that our funding came from the CDC by way of DPHHS. I think that we certainly want to be collaborative between all these groups. We don't want to work in any kind of silos and not be efficient and utilize the funding to the best that we can. And so the Healthy by Design group, I know that we have been in contact with them and working with them. I do think they are two different funding streams, although with the goal that may be very similar of training community health workers and other community intervention folks, especially out of the issues that COVID has brought up for us. So I do know that we are collaborating, but I don't think it's the same funding resource. And Sarah, if you have anything else, that's my understanding.
Well, that's good. That just shows that more than one part of the federal government has recognized that this is a huge issue, and the more community health workers you can get trained, better. And then it'll be useful, I'm sure, for that group once this grant is, terminated, to have you guys as a fallback to continuing cutting edge education to keep them sharp in their position. So I just wanted to see if you already were part of it, or we could use you as a resource in the future. So thank you.
Yep. And Dave, I see your question. You just had to bring it up, didn't you?
Well, which one?
The medical schools.
Well, before we talk about that one, I'd rather have you focus on the workforce shortage. There's a question up on that. We all know that rural areas, remote areas, especially in Indian country, have been challenged long-term with workforce shortages, and that aggravated by the pandemic. And I'm wondering if you can sort of give us some idea about what initiatives you have that are specifically aimed at dealing with that have been longer term, and whether or not we are beginning to recover at all with the workforces, especially in rural areas. It's bad enough in urban areas, but I'm wondering if you have any kind of insights about what's happening in remote and rural areas and whether or not we're making any progress.
Sarah's going, take it over, Sindra. Rural and frontier have had challenging workforce issues forever. As you may be aware, there are several counties within our state that do not have a physician at all. Some that don't have any of the mid-level type physician providers, or not physicians, like PAs, NPs. And that has always been the situation. I think one of the things that we have seen that may be a resource is the use of telehealth availability, and that may help some, but that may not take the place of a face-to-face encounter. I think COVID's been really hard and has really made those rural areas really struggle even more than they have. And we need to think of creative ways. Maybe it's a different type of a different way to provide healthcare. Again, maybe telehealth, maybe a hub and spoke kind of model where there's a central primary care and then smaller clinical areas that might be staffed by mid-level providers. I don't know, Dave, if we're making a lot of headway. Certainly we've seen a lot of issues that have come to light more extremely through the pandemic, but some of those issues have been very, very long-standing, as you know.
So,
Um,
and what about with respect especially to the issues of health equity that are raised by the shortages in remote areas? And I'm thinking about Indian country. Do you have any kind of a relationship established to work with IHS to figure out what those new strategies might look like that are uniquely suited for the reservations and for Native Americans in rural areas?
I would say that I don't have much background on that, Dave. We do work with IHS on the Graduate Medical Education Council, and have a working relationship back and forth that way, although that may be more kind of policy related. We do know that we have started some programs. WWAMI has started a program similar to the co-op program for nursing that is looking to recruit tribal students and really focus on how they can get through the university system a little bit better, and getting some extra resource maybe as they get into the health professions programs and into WWAMI specifically. So I think there are some programs that are starting. The College of Nursing has a longstanding program called Co-op, which is Caring for Our Own program. And that, again, longstanding and very successful there for nurses that have been come to the College of Nursing from tribal and reservation areas and then want to go back there. So there are programs that are existing and hopefully expanding somewhat as far as the student recruitment and student populations getting into the health professions there.
And of course, as you mentioned, I had to raise the question about the medical schools that are under construction. There's one here in Billings and one in Great Falls. What do you see as your foresee as your relationship with them programmatically? Are there obvious connections, or is it going to be sort of a struggle for resources now that we have some competition? I'm thinking more especially about WWAMI. Help us sort that out a little bit.
I would say to be determined, maybe. I know that the Ahec system may do some support for student rotations. There will be a lot of students coming down the pipeline here, and again, that competition for training sites, we'll just have to see how it plays out. I know that the Ahecs again may do some support for students, as they do for WWAMI students, from a housing and placement standpoint, but it's going to be a lot of medical students in the state, and I think I'm just going to pass on that one.
That's fine. That's fine. That's fine. Anybody have any questions? I don't want to dominate, but I some questions occurred to me while you were going through your presentation. A lot of the people that participate in the coalition's work here in Billings are working and a number of positions, entry-level positions, and they would like to advance their career. And they're always looking for opportunities. And your website is very helpful, but is there a place on the website where they can go and put their name in to become the recipient? I noticed that you have all kinds of newsletters and that sort of thing, but I'm thinking about training opportunities for people that are literally at entry-level positions, let's say in home care agencies, that would like to move from that elsewhere. Are they better off going to, for example, here in Billings, City College and becoming and enrolling there, or are there programs that you have that are intermediate steps to being there?
I would say, Sarah, if you want to talk about the behavioral health programs, I think we have lots to offer in that realm that would be easily accessible and may be reimbursed. So.
Yes, yeah, that's what I was going to actually point to. So this is under the lead of Beth Ann in our office and Casey Ballard, but there are so many opportunities under the behavioral health workforce side of things. We have everything from maybe some mental health youth first aid training, youth mental health first aid training, ASSIST, which is the applied suicide intervention skills training. It's a 2-day very in-depth training, and also QPR, which is question, persuade, refer. All of these trainings are offered through our office, and I believe there are some stipends and support, I guess, to alleviate the barriers that might be associated with signing up and all of that. So there is a training schedule on our website, and I can also put, I know that actually Casey Ballard has a behavioral health training newsletter. So if folks want to reach out to her and sign up for those opportunities, those get delivered to your email box and you can sign up that way, or just be kept in the loop on what those opportunities are. Because I know a lot of their programs do support and provide funding to advance careers that way too. So not just through the enrollment of higher education, but also more affordable options as well. So I will put her information in here. Sorry, just a minute. There's Casey's information. And I also want to. And she heads up the Montana Family Support Program, which again really supports those opioid use disorders and substance use disorders specifically. But there are also some behavioral health I guess, supports, in place for community health workers and community paramedics that are hoping to gain training in this area.
For those of you that are on the call, this is an opportunity for you to ask questions about your organization's training needs or those areas outside. We've got Rachel from the hospital in Crow and Northern Cheyenne. Keely, do you have any questions? Roxanne? So
hello.
Go ahead.
I was just curious, what's the best way for folks to find out? Is it just really ushering people to the website?
Primarily, yeah. So we do keep our training schedules up to date, and also send out many mailings and whatnot through the email listservs. So that's usually the best way to stay up on things. We also have a pretty active social media, so through Facebook, LinkedIn, and all of those as well. So we try and really connect the dots and meet people where they're getting their information.
Great, thank you.
So when it's all said and done, I was talking over a cup of coffee with someone about your programs, what would be the two things that you would want to make sure I said to someone about as a result of your presentation this morning? When you boil down all the programs, what two things can you say are the most important about what you're trying to do, what the mission is of your programs?
Go ahead, Sarah.
So from the Office of Rural Health side of things, I would say that our office is really just here to be a support and resource for rural healthcare facilities as, you know, they might be embarking on that needs assessment process or looking even on the other side of things, on the implementation planning side of things. So maybe how they're improving processes and looking forward to connecting the dots there. So I would really say that just supporting and being a resource for rural health. I would, if you have any questions or if we can be a resource, our office would love if we could be that for you guys and really connect those dots and support rural.
I would mention from a workforce standpoint, we really do have rural and underserved in our blood, and realizing that rural communities are very unique, very different than trying to hire somebody into an urban. And when we say urban, we're looking Billings mainly. I mean, it's just a different kind of a skill set that's needed and different ways of doing that. One of the things in our trainings, most of them are virtual, and honestly, they were that way before COVID came around because to get to the real rural and frontier areas, that is not maybe possible for those folks who might want some training to come into Billings or come into the university settings or whatever. So virtual and distance learning has always been a high priority for us because, again, we know that the rural communities and folks who might be interested can't just pick up and move to a standard university setting. So we are rural and frontier focused, and that's a different animal, and we hope that we can serve those needs.
Okay, everybody's being very quiet. I'm not sure if it's the cold weather, but does anybody have any questions of these two fine representatives from Bozeman and their programs? Well, it doesn't look like it, so I'm going to thank you, Sarah, for agreeing to do this, and Cinder, thank you for giving us the overview that you did, and I appreciate the time you've taken from your schedules. And with that, we will, unless there's any questions, we will stand adjourned.
Thank you.
Thank you for everybody. Have a great day, a great week.
You as
Yeah,
well.
thanks.
Bye-bye.
Goodbye.
Bye-bye.